Greetings, everyone. This is Eric Hong, Executive Director of the Momiji Healthcare Society, speaking to the tenants in our seniors residence and their families. Today is Thursday, January 21st, 2021. I would like to begin this message by wishing you all a happy new year and a healthy 2021. I hope that each in our own way, we had all been able to celebrate and enjoy both Christmas and New Year despite the unusual circumstances that we have found ourselves in the shadow of the COVID pandemic. In the lead up to Christmas, I had posted a message reminding everyone of the lockdown restrictions that the government of Ontario had imposed to combat the escalating spread of the COVID-19 virus. Specifically, each household was to celebrate by itself, that if there is only one person in a household, he or she should only socialize with one specific other person from one specific other household and no more. Our natural tendency during the holiday season is to visit with or be visited by our loved ones, be they our grandparents, parents, in-laws, siblings, children, or grandchildren. However, the government lockdown requires that everyone refrain from the usual seasonal parties and family get-togethers. That was incredibly difficult during the Christmas and the New Year season, I know. At Momiji, we have seen children, grandchildren, and other family members take turns visiting with tenants. While that seemed to be in compliance with the one visitor per household rule, it really was not. Although one person is visiting on each occasion, when various family members rotate among themselves visiting, each tenant would actually be in contact with multiple other persons over time. That raises the risk of infection spreading. We have also seen families comply with the advice to not enter the building. The weather was too cold for outdoor visits. Instead, they met with the tenant in the lobby. Consequently, everybody piled into the front lobby and created a crowd situation and again raised the risk for potential transmission of the virus. The intent of the one visitor rule is to limit the absolute number of people coming into contact with each other, and so minimizes the risk of potential infection being spread unintentionally and unknowingly. The more individuals you come into contact with, the higher the risk of the COVID virus being passed from one person to the next. With the volume of visitation to Momiji that we have had over the holidays, we have been incredibly lucky not to have had anyone caught the COVID virus. Let me be clear and reiterate. The one visitor per tenant rule at Momiji that applies even now means only one specific person from among a tenant's family and relatives is to be the designated visitor to each tenant at Momiji Seniors residence. It does not mean that various family members can rotate among themselves and take turn visiting at Momiji one at a time. If in doubt as to whether someone should visit, please consult with Momiji staff for clarification and confirmation before visiting. It is by everybody cooperating and complying with the advice to maintain masking, social distancing, and frequent hand washing that we have been able to keep the virus from spreading into Momiji through the past 10 months. Until this wave 2 of the COVID-19 infection spread is brought under control, please work with us by designating only one specific individual in the family to visit your loved one who lives at Momiji Seniors residence. Turning to the subject of vaccination. By now, you have probably heard that at least 2 vaccines have been approved by Health Canada for use to fight this COVID-19 pandemic. But it will be some time before production of the vaccine can meet global demands and reach a level of ready availability everywhere. The Government of Ontario has announced how it is prioritizing who will be vaccinated first and who will follow sequentially, with the goal of having everyone who wishes to receive the vaccine do so by the summer of 2021. It is our understanding that the vaccine will be offered in stages to people at each priority level on the basis of relative risk for infection and vaccine availability. Frail older adults, primarily those in long-term care homes, retirement residences, and other congregate living settings, as well as essential healthcare workers, are to be among the first groups to be offered the vaccine. Each person can choose to be vaccinated or not vaccinated. It is not compulsory for everyone at this time. Momiji Seniors Residence is not a long-term care home nor a retirement residence. It is, however, an assisted living and supportive housing environment, which is considered one of the high priority congregate living settings eligible for access to the vaccine during this first stage of the vaccination program. We anticipate for Momiji to be contacted by the authorities when it is our turn to arrange for members of our community to be vaccinated. It is our understanding that not all Momiji staff will be given quick access to the vaccine. Only those who are regularly in direct contact with seniors residence tenants will be vaccinated first. Tenants in Momiji Seniors Residence will be next on the list. Those of us on staff who do not have much day-to-day interaction with our tenants will be vaccinated later. As Executive Director, I expect and intend to be the last staff person at Momiji to be vaccinated. We will be approaching each tenant soon to ascertain if he or she wishes to be registered for the vaccine when it is made available to Momiji. Some have asked us about whether caregivers or sitters in their employ and who spend substantial amount of time with the tenants will be vaccinated through Momiji. Families of tenants have also asked if they themselves might be able to get vaccinated as visitors to the seniors' residence. We know we will be asked by the vaccination planners to identify employees of Momiji and their respective intensity of interaction with our vulnerable clients, meaning our tenants. Who else is considered essential visiting caregivers has yet to be made clear to us. We will pass that information on to you as soon as we become aware of it. We will also inform you as to when vaccination will be available as soon as we have seen or have been advised of it. I hope I have given you information that you seek at this time. If you have further questions about vaccination, please ask me or any Momiji staff, and we will try to help you find answers to them. Thank you.